Okay, so the next set I'm gonna talk about is something that addresses the negative symptoms a little bit more. So the negative symptoms, we're saying that it has something to do with serotonin. And a lot of them will have, okay, so basically you want to improve the serotonin, so kind of increase 5-HT. And the atypical or the second generation antipsychotics kind of address this problem here, these negative symptoms. And there's a very extensive list again for the atypical antipsychotics, but I think there's 3 specifically that you really absolutely need to know, and the other ones you should probably recognize by name that it is an antipsychotic. So the 3 drugs here is clozapine, olanzapine. Okay, so these 2 are notorious for weight gain. And then there's another one, aripiprazole. And that one is known for the fact that it's a partial agonist. And since it's a partial agonist, it doesn't have as much of the adverse effects as some of the other drugs. So you can imagine if the other ones give you so much weight gain, this will have less weight gain, not as much weight gain. So this less side effects, adverse effects.
So increase serotonin, is that what we're doing? Or is serotonin blocker, right?
I think it blocks the presynaptic one, so it actually does increase the amount.
Yeah, it increases the amount of serotonin.
It does, but it kind of blocks the presynaptic regulatory one.
It's like alpha 2.
Yeah, it's kind of the same idea as alpha 2.
Okay.
Yeah. Okay, so these drugs, they still have some effect on dopamine, just not as much. So they will mainly do increase serotonin, but still some decrease, some blocking of dopamine receptors as well. So it kind of addresses both the negative and positive symptoms, but definitely more the negative symptoms. And serotonin in itself is involved in satiety. So a side effect of a lot of these drugs is weight gain, which is also attributed to the fact that it's increasing the serotonin. So just know that a lot of the antipsychotics will give you weight gain because of the effect on serotonin.
Typical ones too.
Typical, not so much, because that's mostly, yeah, it doesn't really do too much serotonin effects. So typical ones don't really give you that much weight gain, but they do give you a lot of motor abnormalities, right? So on the other hand, since it doesn't do as much, this is less than typical. So since if you do less of the dopamine blocking activity than typical, a lot of them you don't really see these motor abnormalities. And that's one of the main advantages of atypical antidepressants. So less dyskinesias. So dyskinesia being any kind of motor abnormality. And I think this is the main things you need to know in terms of atypical antidepressants. All right, I think I'm gonna Are there any questions?